Strains are the stretching or tearing of a muscle or tendon. There are two kinds of strains, chronic and acute. Chronic strains happen over a period of time, example, tennis or baseball. Acute strains happen by accidents like slipping on ice or lifting a box in an awkward position. The signs and symptoms are pain, swelling, and muscle spasms. Treatments are RICE, rest, ice, compression, and elevation. If bad enough, strains can be treated with therapy and surgery. A sprain is the stretching or tearing of a ligament, which is a fibrous tissue that connects the bones and joints. There can be serious and minor sprains. A ligament can have a partial tear or even be torn all the way. You can get a sprain by falling, getting hit, or twisting. There is an increased risk for sports players because of increased physical activity. The symptoms for a sprain are pain, swelling, bruising, and being unable to move. You may even hear a pop or tear when the injury occurs. The more pain and swelling there is, the more severe it is. For most sprains, you can just use RICE, which is rest, ice, compression, and elevation. You can also use pain relievers such as ibuprofen to minimize discomfort. For a grade 2 sprain, you may have to immobilize it with a splint. For a grade 3, you may need a cast, and it puts you at risk for permanent immobility. Inflammation of a tendon, which is a thick cord that attaches bone to muscle. Etiology. Tendinitis is most often caused by repetitive minor impact on the affected area or from a sudden more serious injury. Some examples are golfing, tennis, skiing, and shoveling. The symptoms of tendinitis include pain at the site of tendon and surrounding area. Pain may gradually build up or be sudden and severe, especially if calcium deposits are present. An example is loss of motion in the shoulder called adhesive capsulitis or frozen shoulder. Treatment for tendinitis are pain relievers, corticosteroids, which is an injection of corticosteroid medication around the tendon to relieve pain and inflammation. Platelet-rich plasma treatment is taking a sample of your own blood and spinning the blood to separate out platelets and healing factors. The solution is re-injected into the area of tendon inflammation and therapy.
Muscular atrophy. Muscular atrophy is when muscles waste away and lose function. It is mainly caused by two things, malnutrition and lack of physical activity. Sometimes disease and injury can make exercising daily a hard task to accomplish. The signs and symptoms of muscular atrophy include loss of appetite, dizziness upon standing, low iron levels, visible weight loss, limited definition and loss of muscle strength, and also limbs may appear smaller than the other but not shorter. And the patient's right leg is skinnier than the other and weaker. Treatments may vary significantly depending on which type of muscular atrophy you have been diagnosed with, including proper amount of exercise, physical therapy, medications, and surgery.
Torticollis. Torticollis is when the neck tends to twist to one side, which causes a head tilt. Spasmodic torticollis is when it runs in your family history. You usually develop it between 31 and 50-year-olds. It develops slowly, and if it's left untreated, it can be permanent. Acute torticollis is what happens from trauma or reaction to medication, and it develops quickly. Signs and symptoms are a tense and tender neck and shoulders, back pain, neck cramps, burning sensations, muscle tightness, and headaches. Treatment is targeted to relax the neck, such as medication, physical devices, physical therapy, stretching exercises, surgery, or botulinum toxin.
Botulism. Form of poisoning in which a bacteria toxin prevents the release of ACH at the neuromuscular junction. a neurotoxin caused by Clostridium botulinum bacteria, and there are 3 types: foodborne, wound, and infant. Signs and symptoms include paralysis, trouble breathing, drooping eyelids, difficulty swallowing and speaking, and weak muscles. Treatments include, and not limited to, breathing assistance, antitoxin injection, and induced vomiting.
Trichinosis is a disease caused by eating meat that has not been thoroughly cooked. Contains cysts, larvae, or immature worms. It can be found in pork. The signs and symptoms are nausea, vomiting, diarrhea, fatigue, and fever. The treatment is medications such as mebendazole or albendazole and resting.
Fibromyalgia. It's very common. It can't be cured. What it is a widespread muscle pain and tenderness, and there's more than 3 million cases per year in the U.S. Etiology is trauma. It can come from family history, infections, and autoimmune diseases. Signs and symptoms are pain in the muscles, abdomen, back, elbow, or neck. Pain can be chronic, diffused, sharp, throbbing, or severe. Some other signs and symptoms are difficulty sleeping and anxiety. And it cannot be cured, but treatment may help. Some treatments include talk therapy and stress reduction.
Myasthenia gravis, a weakness and rapid fatigue of muscles under voluntary control. The cause is circulating antibodies cause weakness by blocking acetylcholine receptors. Symptoms include weakness in the arm and leg muscles, double vision, difficulties with speech and chewing. And treatments can't be cured, but treatment may help. Some medications, therapy, and surgery can help.
Muscle dystrophy, a group of genetic diseases that cause progressive weakness and loss of muscle mass. The causes: abnormal genes mutations interfere with the production of proteins needed to form healthy muscle. Signs and symptoms: pain in the muscles, abnormality walking, trouble breathing or swallowing, cardiomyopathy, constantly walking on tiptoe, scoliosis. Treatment: medications, prednisone, therapy, physical exercise, surgery, or a splint.
Tetanus is a bacterial infection that causes painful muscle spasms and can lead to death. It occurs when the bacteria Clostridium tetani, found in soil dust and animal feces, enters a deep wound. Spores of bacteria may produce a powerful toxin, tetanospasm, which actively impairs your motor neurons. The signs and symptoms of tetanus include muscle cramping and spasms, sometimes so strong that it can break bones, fever, high blood pressure, difficulty breathing, eventually causing death and painful muscle contractions, usually in the neck or jaw. Tetanus can be prevented by the vaccine tetanus diphtheria, but there is no cure. The wound can be cleaned and you will be given medications such as antitoxins and antibiotics to manage complications. Rhabdomyolysis is a breakdown of muscle tissue that releases myoglobin, a damaging protein, into the blood. The most common causes include the use of alcohol, illegal drugs such as heroin or cocaine, extreme muscle strain, especially in an untrained athlete. However, it can happen to elite athletes as well. It can be more dangerous as there is more muscle mass to be broken down. A crushing injury such as an accident or fall, long-lasting muscle compression caused by prolonged immobilization, lying unconscious on a hard surface, and high doses of medication such as antipsychotics or strains. Signs and symptoms include vomiting, dark or reddish urine, decreased amounts of urine, weakness, muscle aches, exhaustion, inability to exercise, water or electrolyte imbalance, muscle cramping, and kidney damage. Early diagnosis and treatments of symptoms is the best. Treatments include intravenous fluids to help maintain urine production and prevent kidney failure. Dialysis is needed if kidneys fail. You may need a fastening to relieve tension / pressure. Loss of circulation if compartment syndrome threatens muscle death. Muscle death. Yeah, muscle death or nerve damage. Doctor may recommend limitations on diet and activity.
Yeah.